If we shift over to like, all right, how does magnesium impact certain systems, the cardiovascular system? That's a really big one. What's the main effect of magnesium within the heart and complete cardiovascular system?
You don't get enough magnesium, you'll start having cardiac arrhythmias,
Hmm.
supraventricular arrhythmias. You'll have something called Torsades de Pointes, which is like basically prolongation of the QT interval. You can drop that of sudden cardiac death if you don't have enough magnesium, basically because the heart will just start kind of spasming. And so you'll lose the good function of the heart. Part of the reason why is because magnesium controls the electrolytes going in and out of the cell. Sodium and calcium will actually start building up in the cell in the heart if you don't have enough magnesium, calcifying the coronary arteries as well. And you will lose potassium from the cell if you don't have enough magnesium as well. And you obviously need potassium for a good heart, rate, rhythm, etc. And so when it comes to the heart, that arrhythmias are probably the biggest, issue. And there was one study where they put women on about 110 milligrams of magnesium per day, and about 25% of them within like a month developed AFib. Just from that. And so we know that you have to have a minimal amount of magnesium to prevent arrhythmias from kind of kicking in.
Oh, another heart condition that impacts a lot of people is hypertension.
Yeah.
And a lot go on hypertensive drugs is the number one thing to do. You just go on, but you wrote that could actually lead to magnesium depletion in the body. Are we just creating, by placing people on these drugs that deplete, a kind of vicious cycle? It's like you go on it to treat the cause, but then you deplete magnesium, which exacerbates it. Are we just doing this rotating kind of thing? Go on the drug, you need more magnesium, it depletes more magnesium. Is that kind of what you're seeing when a lot of these drugs interact with the body?
Yeah, I think for one, if you are being put on a thiazide diuretic, like either hydrochlorothiazide, which is HCTZ, chlorthalidone, or indapamide, those have been shown if you are on those for 6 months or longer, 80% of people tested have magnesium deficiency. And
Hmm.
so that definitely is a big one induced. And what's crazy is it causes elevated magnesium in the blood. So you might think you're overloaded, even though you're depleted when you're on a thiazide diuretic, which is very weird. So it's one of those things that you don't even realize. A doctor might test you and be like, oh my gosh, your magnesium's great on this thiazide
Hmm.
diuretic. I don't need to give you magnesium. And in fact, it's the exact opposite. And so magnesium helps lower blood pressure. It helps basically relax the smooth muscle on the basically surrounding the arteries, and helps to be, it's basically your natural vasodilator. We used to treat hypertension and preeclampsia, et cetera, high blood pressure in pregnant women with magnesium. That was our blood pressure medication back 50, 60 years ago.
Yeah, it almost seems we should go back to those times and start there before we
Yeah.
move into the more, kind of powerful drugs that we place ourselves on. And now
Yeah.
another big system in the body that's right up there with the heart is the brain. Let's talk about how magnesium impacts the brain. And let's actually start somewhere that people know a lot about magnesium, which is sleep. I know a lot of people that take magnesium before they go to sleep. They say it improves their sleep. How does that work?
So magnesium helps to form the feel-good neurotransmitters, serotonin, dopamine, and noradrenaline. So depression, mood, et cetera, is very important. But serotonin ends up forming melatonin in the brain.
Hmm.
And so you need magnesium in actually order to make melatonin, which we're supposed to release a couple hours before we get sleepy. And
Yep.
so when you are deficient in magnesium, you're not going to release as much melatonin, and thus you will have difficulty falling asleep.
Do you ever recommend people take melatonin with magnesium, or should you start with just magnesium? Because again, people like taking things to help them sleep,
Right.
and it's probably much better than the Ambiens and other sleeping pills. But what would be your recommendation for someone having some trouble with sleep? Start with magnesium. Don't worry about mix the two. What is it?
Actually, the number one supplement that has helped my patients out the most with sleep is inositol,
Mm,
by far and away. But secondarily would be magnesium glycinate, and then
mm.
after that, glycine, 3 grams of glycine an hour before bed, and then also L-theanine, 200 to 400 milligrams. I think about an hour before bed. Most people get benefits with that too.
It's a nice stack because, of course, the L-theanine, anxiety levels, things like that, especially if you're doing caffeine, they say take L-theanine. But you
Yeah.
wrote about that, so the big impact that magnesium has on mood, anxiety, and depression, which basically everyone seems to be dealing with some form of. What's that correlation if you're going to go to like depression and how magnesium works with that?
Well, we have these SSRIs that we typically treat depression with. Basically, they're serotonin reuptake inhibitors. They try to keep serotonin elevated to improve your mood. But as I had just mentioned, in order to form serotonin, the enzymes required to do that require magnesium as a cofactor. So the natural way to boost serotonin is magnesium supplementation. And a lot of people's serotonin levels are low because of magnesium deficiency. So why give a drug when it's potentially a deficiency in an essential mineral?
Right.